And I'd like to see that. At one time, I remember the government saying it was going to work towards that effort, and I hope it will again.
Thank you, Ms. Bonds. Harry Red, if you would like to add to that.
Sure. I've been a day laborer, and so I understand the dilemma as you know, immigration has become a greater part of the national fabric over the last 20-25 years. One of the things I would hope we would do in the city is allow licenses for everyone who's in this country. And that would kind of stave off the negativity part of it. But I believe that there should be a day labor outlet where contractors can come and a space specifically for those who are looking to catch out for work. So I'm definitely for those who labor in these special professions, those who are underskilled and not even certified, but those folks need to work, and we need to make a place for them.
Thank you, Mr. Red. Can you do me a favor and pick up that mic? Thank you. My next question is, how would you improve training and employment opportunities for Latinos? I would like to start with Anita Bonds.
Okay, training and employment opportunities for Latinos. Okay. Well, you know, the Latino community is unique in that it is one of the smallest demographic groups that we have in the District of Columbia. But it's not unique in the kinds of services and needs that it has. Those are some of the issues that we wrestle with every day for the mainstream for everyone in the District of Columbia. And I think we have to do an application for the Latino community that would, one, help with, you know, whatever language barriers that we have initially, so that we can make sure that we are addressing the issues properly. But I am for a holistic approach, one where the Latino community is incorporated and included in the services that we have for the general community.
Thank you, Ms. Bonds. Matt, if you would like to go ahead.
So first, like many things at schools, we need to have our kids be educated and given the skills that they need to go on to the next thing. Sometimes it's college, sometimes it's the workforce. We need to strengthen our schools in the places where the Latino community is the most present. The community college also plays a big role. UDC can play a role. Apprenticeship programs, the district supports all kinds of those things. We need to support them everywhere, for every community, but we need to make sure that they reach the Latino community in strength. Another thing that we do, and that we're moving to doing, is having a workforce intermediary. And we should have part of that workforce intermediary be a dual language workforce intermediary to work with people in the Latino community to make sure that they are linked up with the jobs that are out there. And we need to think about the jobs not just as, you can think about these training programs as construction. People need to be trained for every kind of job. We can also have incubators of innovation with high-tech jobs and training people in the Latino community for that. That sense has 1 minute left, which I'd be delighted. Thank you very much.
Thank you, Matt.
So right now, with regard to workforce development programs, we tend not to measure any outcomes of said workforce development programs. So we spend a lot of money on workforce development, but we do very little outcomes measurement. So what you have now is you have situations where individuals can be trained, but then there's no job placement. So it's nice to have a certificate to hang on your wall, but if you're not getting a job, what was the point of that? We have a rock-solid model that is run by one of DC's most famous Latinas, and I'll bring it up again, Carlos Rosario. They looked at what jobs exist in the District of Columbia. So they chose nurse's assistant, computer technician, and culinary. 3 big industries in the district. 90-some-odd% of those graduates are being placed in jobs related to that field. So why don't we replicate things that work versus hand out money here, there, and everywhere to people where outcomes are not being measured.
Thank you, Patrick.
I proposed when we announced our platform on December 17th, a program for returning citizens, those who were previously convicted. Well, for the Latino community in specific, I proposed what we call Let's Work, LETS, Latino Employment Training and Services to Work program. And it's much like our recap program, where we would offer at city expense, the city would pay for automatic bonding. Why? Because that takes off the table the complaints of the Chamber of Commerce. We will hire them, but our liabilities at stake. I think that's racially tinted, but one, bonding. We'd opt in to a stipend-based employment training service program, where we are training toward jobs with placement on the back end. That's one of the problems with our training programs at DOES. We would also have a skill match assessment. I know time isn't over, with an ESL component encapsulated with it. It's more to it, but not right now.
Thank you, Mr. Red. And Gabby will ask one more question, then we'll let the audience ask questions. Oh, Anita, did
None of us remember. Isn't that something?
Yeah, no,
We all get over.
I believe that we still have,
yeah.
that you still.
All right,
have to answer
okay.
that question. Sorry.
Okay, with regards to training and employment, again, there are numerous programs that we have, and as my colleagues have stated, many of the programs have not worked effectively for anyone in the District of Columbia. And I think we have to be a little more comprehensive in our approach. If we really are trying to get jobs for people, then we really have to focus on matching an individual and their skill level to an actual job. And that's something that we have done very poorly in the District of Columbia. As you know, there are over 300,000 jobs waiting in the District of Columbia and surrounding jurisdictions. But the District of Columbia average worker does not qualify for it. Why? Because our training is poor for the jobs that are available. And so we really have to focus on training people for existing jobs. And I think when we talk about the Latino community, we're speaking of everyone who is looking for a job.
Thank you, Mrs. Bonds.
I'm sorry if we created any confusion. So to make it clear, we're going to start with Perry and move down to this next question. And so let's move on to a different topic regarding programs and resources on healthcare. So what would you create or support to achieve better quality healthcare?
One unique thing about Washington, D.C. is that we have a healthcare system that preceded the Affordable Health Care Act. I know for men and women who come out of prison, they instantly or automatically qualify for health care when they return into society. So we're doing a suitable job there. More importantly, I would fully fund and overhaul what we have east of the river with our with United Medical Center. We need a first-rate trauma center that rivals any other in the country for low-income and people of color. And it does not exist right now. And so, as far as healthcare goes, I would continue to strengthen what we have with Unity and the groups like that. And I would strengthen UMC with full funding and a different oversight mechanism.
So I'll start with an example. I'm probably the only one running who will cite this example, but there is a bill in the council now that will it will inflate the number of nurses. It institutes a ratio, an increased ratio of nurses. This sounds great. The problem with increasing the ratio arbitrarily is that folks who are nurses assistants, folks who are lower level positions, orderlies, they will lose their jobs to make room for these additional nurses. The other interesting thing here is that it does not better our health care at all. And in fact, by increasing the number of nurses artificially, we'll be increasing the jobs for Maryland residents, and we'll be decreasing the number of district residents who are employed as nurses, assistants, and orderlies. Secondly, we have to continue to make sure that the appropriate health education at each grade level in the schools is taught.
In many ways, the district is in a pretty strong position on healthcare. We are, as Perry said, sort of in front of the Affordable Health Care Act, in that we insure more people. As the Affordable Health Care Act comes into place, there is the danger that illegal immigrants will have a more difficult challenge in front of them, and we need to address that. Among the things that we need to do is strengthen our community clinics. We already have fabulous community clinics, Mary Center, Washington Free Clinic. We need to strengthen the healthcare that is delivered, the preventive healthcare that is delivered in our schools. We have clinics in some of our schools. We can have clinics in more of our schools. Unity actually does that in some places. We need to emphasize it particularly in our high schools so that we can deliver healthcare as easily and quickly to people and make it as accessible as possible, and turn